Hi, everyone, and welcome to this segment of What's on Our Minds. My name is Amy Perello, and I am an Implementation Manager for EBSCO Health on the Clinical Solutions team. A few weeks ago, we celebrated Valentine's Day, and I was remembering this article I once read that said, yes, there really is such a thing as a broken heart. It's not just a wives' tale, it's actually a real condition. So I just thought it would be interesting to talk a little bit about broken heart syndrome today and share some information about it from DynaMed. As always, this information is not intended to be taken as medical advice. Every patient is unique, and our tools like DynaMed help support clinicians by presenting the most recent clinical evidence to improve their decision-making, care, and practice. What we want to provide you here is what the latest evidence is saying about some timely topics. According to an article from Harvard Women's Health Watch, which I've linked here in the description, broken heart syndrome is also called Takotsubo cardiomyopathy, and it's named after an octopus trap, if you can believe it. It was first described in Japan 30 years ago. And one thing that is fascinating about this condition is that the vast majority, more than 90% of reported cases, affect a very particular group, women ages 58 to 75. So we are looking at a patient population of typically postmenopausal women. Today is actually International Women's Day, so it seems appropriate to be talking about this condition today since it overwhelmingly affects women. So let's look at DynaMed to read more about this condition. One thing I found interesting with this condition is that the signs and symptoms can be very similar to those of a heart attack, and this condition can be brought on by emotional or physical stress. So it might be difficult for a provider at first glance to determine what to diagnose the patient with. I can see here in the overview and recommendations section that the important difference between broken heart syndrome and acute coronary syndrome is that it's not caused by coronary artery obstruction, and it's often triggered by an emotional or physically stressful event. The exact etiology isn't known. It is thought that it is brought on by a sudden surge of stress, which leads to changes in the sympathetic nervous system. The difficulty is, the symptoms are often very similar to those of a heart attack. A provider suspecting this condition may want to consider a differential diagnosis and rule out heart attack. If you come down to differential diagnosis, you can see the elements that would indicate acute coronary syndrome, or heart attack instead. You can also continue to scroll down and see some of the symptoms and findings that would indicate myocarditis, or some of these other conditions. Once you have a confirmed diagnosis of Takotsubo syndrome, you can read more about managing this condition. Most patients with Takotsubo syndrome have a spontaneous recovery of normal cardiac function. So in-hospital treatment is supportive and aims to minimize complications. You can click here to look at using risk stratification to guide treatment decisions based on risk of complications. Here, you have the European Society of Cardiology Heart Failure Association risk stratification for Takotsubo syndrome. Lastly, we can also look at medications that may be considered. Clicking here takes you to the medication part of the management section so that you can learn more. I hope you found this topic interesting, and as always, please let us know if you have any suggestions for topics you'd like to learn more about. The link for feedback is in the description. If you are a subscriber of DynaMed or any other EBSCO resource and have a question about implementing your resource, learning more about it, or promoting it to your staff, click the link here in the description and ask your question. Use the same link if you are interested in learning more about subscribing to these resources. If you don't have access to DynaMed, you can experience the content in our app using a limited guest access subscription. Thanks for watching and see you next time.